All right, some good hip exercises. If you're having any knee pain, if you're having any hip pain, these are some great ones to do. So Adam, I'm gonna have you stand with your feet about hip width apart, so a little further apart. You're gonna go into a little bit of a squat position. Good, and you're gonna drop one knee in and then push it out. Good, push it nice out far. There you go, perfect. In and out, good. Good, and then switch to the other side. Perfect. All right, next we're gonna go into, that gets the rotary activation of your glute medius. And so now we wanna work on the pelvic stability of that glute medius. So Adam, you're gonna go into a little bit of a squat. You're gonna lift one leg up and bring it back, and now bring your knee out to the side. Good. Don't rotate your whole pelvis. I want your pelvis forward, just the leg comes back and out. And you're gonna hold that. So he's holding that position. He's activating his glute on this left side because it's lifting, but this one's stabilizing. So on this right side, that pelvis is stabilizing, and it's also getting the resistance from the band here. This is one of my favorites. And you can do about a 30-second hold and then switch sides. Good. Great. Now I'm gonna have you can leave the band there or you can put it around your ankles. It's up to you. And these are called band walks. You're gonna get into a little bit of a squat and you're gonna step diagonally backwards. So step diagonally backwards and together. Good. Now try not to rotate your whole body. We really want that hip doing all the work. Okay, so driving that hip back. No, not rotating out. Stepping back, keeping your foot forward and together. Good. And then diagonally backwards. There you go. Keeping that foot forward. Good. And trying to stay in the squat position and not bob up and down. Perfect. Great. And now turn sideways and face the wall. And now we're going to do it sideways. So you're going to stay down, try not to bob up and down, stay in that squat position and push your legs out, stepping sideways. Good. And together. Good. And like I said, you can do this with a band around your knees, or you can make it a little bit harder and have it around your ankles. But if you're recovering from a knee injury, I recommend keeping it above your knees. That will put too much strain on the knee if you put it around the ankles. But it's excellent for strengthening the hip. Perfect. All right. Next, you're going to do it off of a step. And so you're going to have to put that around your ankles this time. So drop it on down. You're going to step, you're going to face this way. You can hold on to here for a little bit of balance. Put your right foot up on the block. Good. And step all the way up. And you're just bringing your foot out to the side. Good. And when you do this, make sure you don't move your upper trunk away as you do it. That makes it easy. The body loves to find a way to cheat and make things easier. So this is really making sure that that glute does all the work. Perfect. Thank you. You can stop. Knee alignment is really important when it comes to running, when it comes to jumping, sports like soccer, volleyball, basketball, anything like that. And so a good check to see if you have good knee alignment and good strength is a simple step down test. So this is what we do in the clinic to assess for somebody's knee alignment. So Adam, I'm going to have you do a little step where you're just dropping that left foot off the box and your knee's going to step down. Perfect. And come on back up. What I'm looking for is if his knee goes directly over his second and third toe, or does his knee collapse in? So Adam, demonstrate if the knee collapsed in. That's called genu valgus. That sets you up for a world of injuries and pain. Your patella tracks abnormally. You can get plantar fascia pain. You set yourself up for risk of an ACL injury. So making sure when you're squatting, you're jumping, that you have that knee tracking right over the second and third toe.